Effects of high blood sugar level. First of all, in this video, we will discuss what the average blood sugar level is. You can determine your blood sugar level by a glucose test, which is done in two ways. One after 8 hours of fasting, which is called fasting blood sugar, and another after 2 hours of meal called random sugar level. The fasting blood glucose should be less than 100 milligrams deciliter, and that of random should be less than 140 milligrams per deciliter. If your level exceeds these values, you have a high blood sugar level called diabetes. The usual initial complication one can face from diabetes is increased thirst and increased urination. However, if you do not notice, it can lead to long-term complications. Now, let's talk about what this high blood glucose level does with different organs. The effect of high blood glucose levels on the circulatory system can damage blood vessels' elasticity and narrow their lumen, which can resist its blood flow and prevent oxygen-rich blood supply to the heart. Moreover, decreased elasticity of blood vessels causes blood to flow with intense pressure, which increases blood pressure, which is also the risk factor for heart disease. High blood glucose levels can damage the nervous system. It can damage nerves, a common complication of diabetes, called peripheral neuropathy, which causes pain and numbness in the extremities like legs, arms, hands, and fingers. High blood glucose levels also affect your vision. It can increase the risk of a vision problem, which can lead to vision loss. However, blurred vision is a common complication for people having high blood glucose. High blood sugar levels also affect sexual health and fertility. It increases the risk of erectile dysfunction for people having diabetes. It impacts fertility in both men and women. According to research, it is found that girls who have a diagnosis of diabetes have problems with menstrual irregularities, and usually they have menopause before their age. Blood sugar level also affects pregnancy. Therefore, a sufficient blood level is necessary for a good pregnancy. Researches also suggest that males having high blood glucose tend to have less sperm count and infertility. On kidneys, it can affect its filtration efficiency to filter waste products. The kidney problem is expected in 1 in 4 diabetic patients. High blood sugar levels can also cause skin complications like dry skin, skin tags, blisters, fungal infections, and bacterial infection. A foot ulcer is a typical outcome for excessive blood sugar levels, and if it gets no treatment, it can even lead to amputation. It can cause psoriasis in rare cases. There are certain metabolic diseases linked with high blood glucose levels, like metabolic ketoacidosis. It's a serious condition in which the body starts to metabolize fats to produce energy and form ketone bodies that make the blood acidic. Without its treatment, it can lead to loss of consciousness. High blood glucose can interfere with life's routine, but it is manageable in an organized way through lifestyle changes, by controlling sugar diet, and by looking over complications. If you have any of the short-term complications, get your glucose test done. Know your blood level if it is above the given range. Seek advice from a doctor, and follow the treatment plan to keep yourself safe from long-term complications.